Well, welcome everyone to our Cancer Prevention and Control Research Network Scholars Program webinar on this lovely Tuesday. And we are all excited and happy that you're all here and able to attend. Our webinar is around community engagement and strategies and partnerships. My name is Courtney Petagna, and I am Emory CPCRN Project Director and also the co-project director for the CPCRN Scholars Workgroup and Scholars Program, along with Allie at the University of South Carolina. I am pleased to welcome our esteemed panelists here today. We first have Dr. Aubrey Villalobos, and she is a health scientist with the Implementation Science team and the Division of Cancer Control and Population Sciences at the National Cancer Institute. In this role, she leads efforts to advance the involvement of practitioners and implementation science to enhance the integration of evidence-based guidelines, programs, and policies for cancer control and public health and clinical practice. She also cultivates research practice partnerships through participation in several networks and coalitions, including CPCRN. And then we have our second panelist, Dr. Linda Coe, and she's a professor and associate chair for research in the Department of Health Sciences and Population Health at the University of Washington at UW. She is the PI of the UW Cancer Prevention and Control Research Network Collaborating Center. She's also the co-director of the Community Engagement Program at the University of Washington Institute of Translational Health and Sciences. Her team has been partnering with the Yakima Valley community in Washington State for the past 12 years using community-based participatory research approach. We are so excited to have both of these lovely panelists here with us today to bring their background and expertise. And they will be discussing around community engagement, the study around community engagement, and the maintaining partnerships with people during, global emergencies such as the COVID pandemic. So I will hand it off to Aubrey.
Excellent. Thanks so much, Courtney, and thanks to all the scholars and others from CPCRN who are here today. I am so excited. Can you confirm, can you see my screen?
Not yet.
Not yet? Okay. One more time. Screen sharing has failed to start. Please try again later. Error code 105035. Excellent. Trying one more time. Did that work? Nope, same error. It's not letting me share. So, Courtney or Allie, shall I email slides to you?
Yes.
Okay, I've never seen that error before.
Linda, will you go ahead and email yours as well to Courtney and I, just in case we run into this issue multiple times today?
Okay, let's hope that is not too large to go through. But I will just kill some time while that is coming through, and you can just start sharing as soon as you get them. But what I am going to share with you today is two projects that I've been working on here at NCI over the last couple years around community engagement in implementation science, and also this field of engagement science and actually studying engagement. And so it'll be a little bit theoretical, tell you a little bit about kind of the state of this in our grants portfolio. And then I'm so pleased that Dr. Coe agreed to be a co-panelist here, have a real researcher tell us how it's done on the ground in the world, because I know that's really helpful for the scholars to hear that and really make it, concrete and relatable. So that is the plan. At the very end, I'll also highlight just a couple of my go-to resources for engagement and implementation science, and hopefully those are some of them will be new to you and or good reminders so that you can revisit those in the future. Courtney and Allie, did that come through?
My email is slow. How about you, Allie?
I have not received Yes.
Sometimes it can take a while.
All right, well, I will just keep talking then, and you can catch up to me when they do come through. But I will also be happy to provide a PDF of the slides so folks can access the links and see the slides later. So the first project that I want to tell you about was a portfolio analysis that we did at NCI. We published this in Implementation Science Communications late in 2023. So you can look at the full paper there for all the information. But really what we wanted to do was across the entire NIH, we wanted to get a snapshot of the current practices or approaches that are being used to engage communities and partners in dissemination and implementation research. And then we had some specific attention we wanted to pay to research that was related to disparities. And why were we looking at our grant portfolio? Was really just to identify gaps and opportunities. And so that is what we did. Excellent, thank you. You can jump ahead to slide 6 for me, Allie. And so we looked at 103 grants from fiscal years 20 and 21. And the reason we were looking at really the recently funded grants, and if you can just switch displays so it's in the audience mode, that would be excellent. And so the 103 grants from the fiscal years 20 and 21, because after the pandemic, you know, there was a lot of conversation around engagement and disparities, and people were paying a lot more attention to this. So we really wanted to see kind of in the recently funded awards, what was the status? So, you know, this is kind of a portfolio analysis. You look at the grant abstracts and the research strategies. You have access on the internal NCI and NIH side. We can look at the whole application, budget justifications, all of that to code. So we, 103 total grants, 26% of them were from NCI specifically. Next slide, please. And so some of the things that we looked at is kind of where were people planning to do engagement in their studies. And really the majority was in formative research and in the design of implementation strategies. I think that probably makes sense to a lot of us, much less so in theory development. You know, only a handful, really a third in intervention design or evaluation or measurement activities. And then we wanted to know who was being engaged. So we used this 7 Ps framework by Tom Concannon and friends from the CTSA world, and saw that direct service providers or practitioners and patients or survivors and their families were the most common perspectives to be engaged in dissemination and implementation studies. But some of these other groups were also engaged, just less often. And you can see kind of at the bottom of the table, purchasers and payers, policymakers, product makers were much less frequently engaged. But on average, each study was engaging around 2.5 different partner types. So really trying to get different perspectives in the studies. Next slide, please. We also tried to code for the highest level of engagement on this continuum that was published by Sanders Thompson and Melody Goodman and friends. And so we saw that most of the studies were really living in the space of just consulting with folks, not really true kind of more deeply, authentically engaged collaborations or partnerships. So that's definitely an opportunity for improvement, I think, in our portfolio of work. And in terms of the approaches that people reported using, some reported practice-based research, community-based participatory research, or just kind of general community-engaged research framework. But really, most of them did not specify what specific approach they were using. It was just kind of, they were describing engagement activities, but no particular kind of grounding in how they were approaching that. Next slide, please. And then we looked at a number of different methods or strategies or activities that were being proposed in the grants. And on average, each study was using 2 to 3 engagement strategies. And you can see here, most common were things like key informant data collection, project steering committees of some sort, those advisory groups that we all love to include in our grants. And then a selection of other strategies here, but some of the more kind of longitudinal or more kind of hands-on and involved strategies were less common. Next slide, please. We tried to look at indicators of equity in how the communities and partners were being engaged. And this, I'll just say, was really hard to code for because this is not always something that applicants include in the narrative. There's a page limit, you know, it's not a scored criteria for the grants. But, you know, we were trying to look at for any indicators of how the people who were being engaged would be able to influence the research. Would it be mutually beneficial engagement? How were they involved in decision making? How were resources being shared with the partners? Who had different, you know, responsibilities for different aspects of the study? How were power and control and ownership addressed? And I think you can see here, you know, really for half of the grants, none of these things were well described, and for reasons I stated, but you know, really no one touched on ownership at all. And I know, you know, particularly in research with tribal communities, but also really research with any, you know, marginalized group that can, the power and control and ownership issues, you know, should really be addressed. And it's very possible that the investigators address these things after, you know, getting their grants and in the process over the course of implementation of their study. But these were some things that we were trying to assess. And then finally, we were looking at whether or not engagement was being measured. And you can see that in the large majority of the projects, there was no assessment of the quality of engagement, no measures at all, qualitative or quantitative, to really kind of assess the engagement itself. Next slide. And then, as I mentioned, we looked specifically at some of the disparities grants, and you can see here that the light gray are the half of grants that were disparities focused projects, and the black lines are the non-disparities projects. And so you can see that the disparities grants were more likely to be engaged research, which I think probably makes sense to us. And we're also more likely to engage at that higher level of partnering or really collaborating with the community rather than just consulting them. So those were a couple things that were not surprising to us, but it was nice to actually see it in the data. Next slide, please. So for gaps and opportunities, and I'll, you know, invite you to read the full article for more, but I think, you know, some of the things that we highlighted were opportunities for implementation scientists to think about how they could really move towards deeper and more longitudinal engagement and across the whole research continuum, not just kind of at that, you know, formative research stage. We also encouraged diversification of partner types who are being engaged. So wanting to see more engagement with policymakers and social service and public health professionals, implementation support practitioners, and some of these other perspectives that were not engaged as often in studies, but are still really critical perspectives for things like scale up and sustainability of the interventions that we are trying to implement. Also, in terms of engagement strategies, encourage using and evaluating more longitudinal and hands-on engagement strategies that that include these different groups. So some of the things like the human-centered design processes, systems mapping, some of these things that take a little bit more time and energy, but may have a greater return on investment. But we don't really know that if we're not evaluating them. And then I think just encouraging for in grant applications to be a little more precise in how we're specifying the approaches to engagement and some of these things around how the relationships are structured. You know, I think that would be nice to see if possible to incorporate into proposals so that we can see how this is evolving over time if we look at this again in a few years. and also encouragement of measuring the engagement processes and outcomes, and thinking how we could include some questions around the engagement in implementation science studies, maybe as an extra aim. And then for health equity specifically, I think we looked at some of the theories, models, and frameworks that were used in the studies, and there are some new theories, models, and frameworks that are either equity extensions of models or have specifically added components or been developed for enhancing equity, and those were not really reflected yet in the grants that have been funded. And so I think just encouraging more attention to equity in the theories, models, and frameworks that we're using and in the populations that we are engaging. Next slide, please. So what's the take-home message here? I think there's through this increased attention to engagement that really has happened over the last several years in our field, there are these new opportunities to study the engagement-related research questions. And I hope that would increase the rigor, relevance, and impact of both of these fields. So next slide, please. And so then let's talk about the second project that I mentioned. Next slide. So this is some kind of preliminary data. This was a project that followed on that portfolio analysis. NCI was able to provide a small contract to RTI International to help with a project around prioritizing some of the research needs and opportunities really at this intersection of implementation science and engagement science. Next slide, please. So in the previous paper, I mentioned that we really kind of highlighted this opportunity for more systematically doing engagement in implementation science, but that would really create this opportunity for advancing the science of engagement. And so what is the science of engagement? Distinct from participatory research that uses these engagement techniques that we are familiar with, engagement science really examines these methods and outcomes of engagement to really continue to develop that evidence base for why engagement matters and how to do it well. And I think a lot of people, who have been doing this work for a long time are really bought into this, but, even PCORI has, acknowledged the need for advancing the science of engagement. They have funded a couple rounds now in this space to really help build more of a quantitative evidence base where historically it's been very largely qualitative. And so really just trying to push it to a more evidence-based space. And so let's talk about what we did. So and I apologize, this has an animation, but we started out with a conversation at the 2022 Academy Health meeting. We had a discussion forum. There were 24 of us there, and we really just went through kind of a brainstorming activity on what some of the gaps and opportunities are in engagement science. And then with RTI's help, we conducted 3 focus groups virtually to talk about kind of the value of engagement, but really these gaps and needs and research opportunities at this intersection of engagement and implementation science. And the focus groups were conducted with kind of early and mid-career scientists who were either in engagement or in implementation science, and some kind of spanned that. Then in September, we had a small expert panel come together virtually, and they voted to prioritize the gaps and needs that were synthesized from the focus groups. And then they kind of tried to turn them into specific research opportunities or questions for those top 10 needs. And the expert panel were senior scientists who almost all, I think, were kind of considered themselves experts in implementation and engagement spaces. But and then we had a patient engagement research advocate partner as well. So really quickly, from the focus groups, there were 28 needs and barriers that were identified related to kind of integrating engagement and implementation science. And the first 15 were kind of under this broad umbrella of really wanting more guidance related to processes and outcomes. And we had some subgroups in there, but I don't have time to get into that now. The second big bucket was around structural barriers. Some of these institution and funder level barriers that everybody bumps up again from time to time. So next slide. So this was the expert panel rankings across the needs and barriers. And so some of these are kind of the process and outcomes things, and some of these are the structural things. So, that investigators really need clearly defined goals for engagement and processes that they can use to make it more replicable so that we can then start to synthesize across studies. The second one was that conducting engagement is not incentivized within research or healthcare institutions. Project budget limitations is a barrier, that engagement is resource intensive. Institutional barriers to contracting with community organizations. I'm sure many of you have experienced that. Accounting for variability in partner preferences and kind of some of those consensus related challenges when you're dealing with diverse community members and partners. The grant review timelines and funding outcome kind of prognosis for submitting a grant and whether or not it gets funded could negatively impact engagement relationships. Needs for training and guidance on integrating engagement into implementation science theories, models, and frameworks. Training and guidance on adapting engagement approaches to different settings, how to do that well. Institution willingness or ability to provide appropriate compensation to engagement partners. And that real change requires institutional buy-in, not just the goodwill of individual investigators. Next slide, please. So the expert panel really acknowledged that some of these opportunities are kind of sequential, right? That some things have to happen before the others can happen, but also that they should be reinforcing, right? So as we have clearer shared understanding of what, why are we doing engagement, what are the processes that we should be implementing and replicating, what are the outcomes we should be measuring. As we do that, then we can generate more evidence-based guidance on how to do this better rather than just kind of continuing with the current practice-based evidence that we've been passing down to, to trainees and mentees. And so, with all of that said, I'm going to highlight a couple of the opportunities that they put forward, and you'll have to kind of wait until this comes out to see the full list. But next slide, please. So in the area of engagement processes, 2 sample recommendations from the expert panel were to look to engagement science for the theories, models, and frameworks that are most useful to implementation science, and then bring some of those constructs into our theories, models, and frameworks that we use. And then broadly, we need more evidence-based recommendations and training materials to guide the conduct of engagement in implementation science. Next slide, please. Related to outcomes, the panel recommended that we start to routinely assess the impact of engagement on the implementation outcomes that we measure. They're referring to Proctor's outcomes there, and really just trying to tie the engagement activities or strategies that are being used to the implementation outcomes. And then some specific questions about engagement that they thought could be integrated into implementation studies are, what are effective and feasible and cost-effective activities for sustaining engagement? And how can we measure the effectiveness of team composition and leadership structure for engagement and research? Those are just 2 examples that I kind of cherry-picked from the list. Next slide, please. And then related to the structural barriers, their recommendation is that we leverage the evidence that's coming out of the research that they recommended to support the structural changes that are needed, because we know we need a research environment that is supportive of engagement in order to accomplish this work. And so, how can we help create that environment? We can use the evidence that we have to then kind of make that more institutionalized. to expand the support for engaged research across institutions. And some of the questions that they thought could actually be answered about these structural barriers, are things like, to what extent do grants that facilitate engagement through their timelines or funding or expectation setting, however they facilitate that, do those grants improve outcomes? And what is the impact of engaged research on trust in health systems for particular communities? And what are the optimal strategies for training researchers and others to participate in or conduct engaged research? So these are just a sampling of questions that they suggested. Next slide, please. So I think the take home here is that in partnership with engagement scientists and research partners, implementation scientists can help address these missed opportunities in studying how to do engagement well, and they can really help build the evidence for the impact of engagement on implementation outcomes. That's the contribution that we can make. Next slide, please. So just a couple quick resources. The first one is a reminder to you as scholars, next slide please, that the foundation of all of the work that we do is engagement. And so feel free to revisit the first module of Putting Public Health Evidence in Action, which focuses on engagement. Next slide please. Another few go-to resources here. The University of Colorado has the Stakeholder Engagement Navigator tool, which I think is great. Helps you make some decisions about some of those strategies or activities and when to use them. Urban Institute has a really nice resource center. And then NIH has the new Community Engagement Alliance consultative resource, and this grew out of some of the COVID-19 work, but they're really starting to put together like a whole library of toolkits and resources and tip sheets and archived videos and all sorts of things. Plus they have a consultative service that is available to NIH grantees and others for minimal fees. It's really trying to kind of continue like sharing that best practice advice to investigators. And then this resource at the bottom is from the National Academies, and they put together a conceptual model for assessing community engagement. So what are the things that we can be thinking about measuring? And then they've also started to put together a compendium of the validated tools that are available for assessing these different constructs. Next slide, please. And then finally, the NCI supports the Community Participation in Implementation Science Action Group. It's part of the Consortium for Cancer Implementation Science. And this goal really focuses on advancing the field related to engaging communities and partners in implementation studies. And a couple of example resources that the group has collaboratively developed. The first one here is a tip sheet, tips and best practices for engaging with rural communities. And then the other one is an annotated bibliography that has a section for researchers and has a section for community members and partner organizations that want to engage in implementation science. And it's got readings and videos and links to websites and toolkits and all. It's an annotated bibliography. So if you would like to join, feel free to email that, and I am finished.
Thank you, Aubrey.
Can people see my screen?
Yes,
Yes, okay.
just presenter, we can see your whole desktop with the slides.
Yes, yeah, I'll move on to the presenter view. Yeah, in a minute. Yeah. I can. Let me try something. Can you see the presentation?
Yes.
Okay,
Excellent.
great, thank you. Wow, I was just listening to Aubrey and seeing all these amazing resources. I'm gonna definitely check it out. Thank you so much for bringing that to to everybody's attention. So thank you, everybody, for inviting me to share about our partnership with the Yakima Valley and how we work together to respond to the global pandemic. I mean, I don't think I have to say much about the importance of community-based participatory research, but as you know, over the last 2 decades, CPPR has moved to the center stage due to scientific evidence and the interest of funders to ensure partnerships are more honest and authentic. And we know that CPPR helps build partnership, intervention development, dissemination, and implementation research. And when bidirectionality really occurs in a partnership, then it builds local capacity, enhance intervention relevance to local context, reduce disparities, improve health status, and accelerate knowledge translation into tools that can be used in the real world setting, just like Aubrey mentioned in implementation science. So the ideal goal is to be able to create a transformative and sustainable change. And in order for us to do that, this is just based on my own experience and also informed by the literature out there on community-based participatory research, is that we need to have an equitable bidirectional focus where we not only focus on outcomes, but also focus on processes and practices. We need to foster capacity changes in the community and academic system. I think there has been a lot of interest in changing the community system, while our academic system still lags behind in how we compensate our community partners, and also focus on health outcomes that increase health equity. So I was really interested in this model. This is a comprehensive and rigorous CPPR conceptual model that was developed in 2011 by Nina Wallerstein from University of New Mexico and her group to capture the processes and outcomes of CPPR. And her team revised it in 2013 to better capture evolving dimensions and subdimensions of the processes of outcomes. So when you look at this image where you see the bolded letters, text, those are some of the new elements that they added in 2013. And this model proposes 4 successive dimensions studying with context, group dynamics, intervention and research, and outcomes, and subdimensions embedded under each of these dimensions. I can go in detail, but I will send you a paper where Nina and her team describes how they developed this model. But in brief, the first dimension, context, and its subdimensions are described as shaping the nature of the research and the partnership. The second dimension is group dynamics and equitable partnerships, which describe how the practice of partnership creates equitable partnerships. The model describes that the group dynamics and equitable partnerships interact with contextual factors to impact the intervention and research design. The intervention and research design dimension highlights the importance of integrating community partners' voices, cultural norms, and knowledge into the research design, research methods, intervention development, and translation of knowledge for dissemination and implementation. So we as academics, we need to be comfortable that the community may come up with an idea that we may deem as being less rigorous and still trust in the system and the process, that at the end, it will come up being the most beneficial for the community. Finally, ongoing interactions between context, group dynamics, and partnership processes and integration of community to the intervention and research design lead to the 4th dimension, which includes changes in system and capacity changes for both community and research institutions, such as the change in policies and practices, as well as health outcomes. So, and this CPPR model has been a guiding framework for my partnership with the community. So my goal today is to describe a community academic partnership with a rural agricultural community guided by the CPPR conceptual model, highlighting the dimensions and the subdimensions, and how the community academic partnerships mobilize to respond to the global pandemic. I will talk about as a case study, the community academic partnership with the Yakima Valley. And I will start with context, and specifically, I will describe the people, the place, the historic collaboration, community and academic capacity and readiness, and how the partnership prioritizes the health issues through conversation and discussions. So the people in the Yakima Valley is the largest farms in number and size in Washington state, and they farm a lot of different things. I didn't know about hops until I actually started collaborating with the community. So I feel like my knowledge about the community itself is growing as well. The 65% of the communities here are Hispanic or Latino origin. 95% of those identify as Mexican American. Many are employed in agricultural and packaging industries, and many immigrated during World War II, the Bracero program, due to when the United States was lacking workforce in farming, then they instituted the Bracero program to be able to bring people to work as farm workers in the United States. But then after the end of the Bracero program, the immigrants still have continued to move to the Yakima Valley to find employment or to unite with family members and friends. One interesting aspect about this region is that during farming season, seasonal workers from within and outside of the US move through different geographic regions. So that became something that we had to pay some attention when we were responding to the global pandemic. So here is the map of the Washington state. The small circle on the left is Seattle, so the King County. And then the larger circle on the bottom is the Yakima County. It takes about 3 hours to drive one way. So it's for a full round trip, it will be about 6 hours. Within the Yakima Valley, you will see like the more blue area on top, that's called the Northwest Yakima. And then the other areas under that is the more South Yakima. People in the region, they call the Northwest Yakima the Upper Yakima. And then the South Yakima, they call it the Lower Yakima. Usually the farm owners live in the upper side of the Yakima. The farm workers and those that work in the packing industry work in the lower levels of the Yakima. So the resources in the upper level of Yakima are they have more rich resources compared to the lower Yakima. And we have been collaborating with the lower Yakima community. In terms of historical collaboration, this community has been sought out by many academic institutions from within and outside of Washington state, including all the way to the East Coast. And there were some trust and mistrust that were developed with the community, and it seemed like it was researcher dependent. Those who build trust with the community, they tend to invest in local capacity, workforce, and returning the results back to the community and coming back for continuous engagement. And mistrust is, so you see a picture there, Sandra Linde, who has been our long-term partner. It's something that she had told me in the beginning when I started engaging with them in 2011, is that they take our data back and leave and we don't hear back from them again. Now, how many times have you heard that? So she always reminds me that that's really not the way to engage with the community. So our collaboration with the Yakima community started out in October 2011, and with a What Next conversation. I was invited to a community advisory board meeting by a senior researcher that I knew, and they were having a conversation about what next do we tackle as a priority from the community. They had just finished up and coming out of a diabetes project. And at that time, there was a very lively discussion about we need to do something about children, their health, and childhood obesity seems to be an issue. And if you remember, in the 2011, 2012, Michelle Obama her campaign was the MOVE campaign. So there was, interestingly, a lot of RFAs that came around nutrition and physical activity, very timely. So we took one of those RFAs and we met with them again and we said, do you want to do this? We saw this RFA, should we respond to this? And everybody said, we want to do it. We collected so many letters of support from city mayors, from local government officials, to schools, to community-based organizations, to just community champions all around across 4 towns, Tappaneer, Sunnyside, Granger, and Grandview, and we submitted a R24 capacity building application, which was accepted, which was funded to build a capacity of childhood obesity and pilot test in multi-level intervention. And then the success of that led to a follow-up UO1 proposal that we submitted to scale up the pilot in multi-level intervention to across the larger community, which was also funded. And then at the end of it, we had many of these interventions being adopted by the community, especially Ciclovia was the one that we were still running the study and they were ready to adopt it. So we were really excited to assist the community with the adoption of the intervention as well. And then as we were moving into the final years of the multi-level intervention of the 5-year UO1 proposal, we had an opportunity to respond to the CPCRN call. So we had a conversation with them and we said, as we are wrapping this up, we have an opportunity here. Is this something that would be of your interest? And they said they wanted to go for it. And they made me promise that we wanted to address rural capacity. So when we got funded, that's exactly what we did. We went back to the community and we have been working with them to build their capacity to implement evidence-based intervention around cancer prevention and control. A year after that, we were, we were all hit by COVID. So we were contacted by NIH that there will be a release for instituting a COVID-19 testing in schools. And they were interested in motivating us to apply for that because of our prior experience collaborating with the school district. So we met again via Zoom and we had a conversation. We said we have these 2 opportunities to bring more testing to the community. And they said, go for it. We want testing in the community because there's a lot of testing that is lacking. Things are spreading really fast. We are agricultural community. People are still working without masking. The resources that were there out in the community, they felt like this was a way to be able to bring more resources. And as we were wrapping this up, we had our next conversation and they said, we want to be able to have more dementia-related resources in the community. So we have been prioritizing and doing education and connecting with different researchers within the university to bring more education of Alzheimer's and dementia to the community. So now moving into the community capacity, I'm going to try to go really fast because I'm realizing that we're about time. I wanted to show this because this is how we think about going out in the community. I think we think about, are we doing investigator-driven research? Are we doing community-driven research? Where does my research fall into the spectrum? But the community really doesn't think about this when we see us. What they think about is, what does their team look like? Do they have people who look like me? Do they have people who speak my language? Are they listening to me to respond, or are they listening to me to react? Are they intentionally investing in the community? And I wanted to highlight a student here who now graduated. He is Luis Aceves. He is from the community, from the region of Otelo in Lower Yakima Valley, and he worked with us for 2 years as a GRA, and now he graduated and he's working for Pierce County Department of Public Health. Here's another student that we met as a student, and her name is Catherine Lopez, and she was volunteering with us first with our COVID project, and then now she has graduated and we were able to fully hire her, and now she is working as a research coordinator in our team. We have a lot of opportunity to print materials, and we could print in Seattle. That will actually be more feasible for us to do in order to pick up and other things. But we go out in the community and we print things in the community. And here's an invoice for about $7,000 because we want to be able to invest in the community, and we want them to know that we are serious about our commitment to the community. And they care if we elevate the community contribution to science. We had 2 community members, one Sandra Lindy, another person, Lorenzo Garza, who has been with me for the past 13 years. there was an opportunity to nominate them for a clinical and translational award at the University of Washington. Lorenzo was the recipient in 2021, and Sandra was the recipient in 2022. So they came all the way to Seattle with their family, and we had a very nice and memorable moment to be able to celebrate their accomplishment and their contribution to science. In terms of prioritizing for health, we have 50 community organization and community members participating in our advisory board. And I'm going to move on really quickly because I have a lot of slides still left. For group dynamics and equitable partnership, that Nina and her team focuses that we need to focus on structural, individual, and relational relations. So, Courtney and Alec, I don't think I'm going to have enough time to cover all of those slides, and I'm actually halfway through. So what do you think will be beneficial at this moment?
Do you just want to do your highlights or what you did at the end with the community, and then we can go to questions?
Sure. Okay. So I'm just going to go really quickly on how to build this relationship with the structural, in terms of structural dynamics, individual dynamics, relational dynamics, and then how they contributed to the design of the intervention. Sometimes they change our community, our research design. They tell us how they would like to see the intervention develop, and I think that enhances the local context. So here are some images of the multi-level intervention that we developed together with them. And some of this, they were just ready to adopt. So we didn't even have to do a lot of capacity building because we spent so much time co-creating this intervention together that after we tested it and they were able to see the data, they were so excited that they were ready to implement them. In terms of outcomes, shows what the kind of attendance that we had from 2017 to 2019. I think one of the important point that I wanted to make in this slide is that our research can have so much more impact beyond health. One of the things that was happening in the Yakima Valley is that, so Yakima Valley is the home of a Yakima Nation, and there was some maybe not some ideal relationship between the Yakima Nation and the local community, and they usually do not participate in each other's events. But in 2019, when we had this event, Yakima Nation gave a helmet donation of about 200 helmets. And then there were people that participated. And I think that was a win that the community felt that it was a historical win for them, because historically there was no participation on each other's events. So that was really exciting to see that there were some social changes that was happening. These are just showing some results of the study. And this says, and then when we were ready to respond to the COVID-19 crisis, we met again and we talked, and then we got funded to institute what we call the risk communication information. This is the aims and then what the outcomes were. And then again, what were some things that we instituted? We instituted MOUs for implementing the study, and also data transfer and use agreement to get access to the COVID-19 testing and students' attendance data. Here are some examples of risk communication intervention that we co-created together with the community. And one is a video here, and I'm happy to share the video too. In terms of best practices, I would say involve the community from the beginning, align research mission with the community's priority, values, and mission. Innovation can come from the community, not only from the researcher. Invest in the community and not just in the project, and be transparent about successes, but also failures. And here you can go to any of these links to get access to the Together We Cite resources, as well as the ROSI resources.
Thank you, Linda. That was amazing. I will give space to the scholars first about any questions. I know there was a question from Com, and if not, we can go to Com's question. But do any scholars want to talk and have any questions? Yeah, Mayoko.
Yeah, I have a quick question. Anything in the budget justification you notice about the community engagement? Like, do you notice, like, for example, like a center grant have a more investment, more budget for the community partners or anything like that?
That's a good question. We didn't look at it like by grant mechanism. I think there were things like budget lines for incentives, for kind of key personnel from partners and sub awards and that sort of thing. But it is something that's an interesting question we could go back and look at in more depth. I think more resources means that you have more kind of flexibility for how you can distribute it, for sure. But Linda, bravo to you for, I apologize, you had to speed through that, but that, is such important work. I think the structures and the processes that you put in place in those projects you described are really kind of the model for how we should do that. And I think to Kam's question of how do we get people to involve community members and partner organizations kind of beyond the formative interviews and research into things like, intervention development, that co-design, data collection development. I think, it's not something that everybody's trained on and familiar with. I think, there's a capacity building element that needs to be happening in graduate schools and our training programs, and mentoring programs like, CPCRN. But it is really something that needs to be hands-on. It's kind of all theoretical until you actually get in there and do it and see how hard it is. And you really have to be committed to the authentic engagement and being present and intentional. I think from funders' side, setting those expectations. I've heard it mentioned from time to time in review, but it's not like a specific review criteria for most, standard reviews around examining like how authentic do those partnerships seem, or how long-standing are they, and less attention is paid to that, but I've heard it mentioned from time to time. So I think as the community of peers kind of raises the bar on expectations for each other, that will help too, I hope. And when there are dedicated funding opportunities that it require engagement and kind of set that out for how how that should look, and putting the resources to it, I think will make it easier, because you certainly can't expect partners to do this work without providing them the resources to be able to do it.
That is so important. Thank you for that last note, Aubrey. Any other final thoughts before we wrap up, or questions from our scholars? I just want to thank you, Linda and Aubrey, for your time. I know I've certainly learned a lot, and all of your resources and the great work that you guys are doing. And I feel like from grants too, to keep thinking about this and integrating community needs and in the grant review process to help engage and expand community engagement. So thank you all for being here today, and a round of applause for our wonderful panelists and their time and expertise with sharing that with us all today. Thank you all.
And I just wanted to share one last note before everyone hops off. That Becky Lee with the Coordinating Center wanted us to remind scholars and anyone else who's interested that there's still time to register for the spring meeting, and there's limited funding available for scholars who would like to come. If you want to present, there's a poster presentation. You can present an already existing poster. It does not have to be new, or if you just would like to attend and not present, there's still space available. And if you want to present, I'll put my email in the group chat for everyone, and you can email me and I can put you in contact with Becky, and we can get you registered for the meeting. But registration ends at the end of this next week. So send me an email as soon as possible and we will help get you registered.
And we can
Becky has more information about funding.
Yeah. And we can continue this conversation at the annual meeting, which will be, I know not everybody will be there, but if you can, I think thinking about this topic as we move into the next CPCRN cycle will also be important. So thank you. This is just the beginning of this topic, even though I know there's a lot more that people want to share. So thank you.
Thank you so much, everyone, for inviting me.
Yeah,
Thank you so much.
you all.
Thank you.
Take care.